mindset shift or neural therapy is a quick way of getting your body downregulate a little bit faster. But really the long-term thing is just changing your perception and mindfulness, just getting to know that you maybe can't control the world, but you can control how you perceive the world. That's a big hidden one.
You're listening to the What the Gut podcast, where busy moms can come for a holistic approach to health and vitality. I'm Allison, your host, a holistic health and wellness coach. In this space, we'll dive into the intricacies of achieving holistic wellness while balancing the demands of daily life as a busy mom. What the Gut is your haven for navigating the challenges that come with juggling numerous tasks while aiming for a healthier, more balanced life. Join me as we uncover practical solutions to common health hurdles, from managing fatigue to understanding all things gut health. Through insightful discussions, actionable insights, and tailored lifestyle strategies, my goal here is to empower you to embrace a vibrant, nourishing life while saying goodbye to being overwhelmed and exhausted. So if you're ready to embark on this transformative journey towards holistic well-being, hit that subscribe button. Get ready to discover the secrets to thriving in motherhood while nurturing your overall wellness. A quick reminder, everything discussed here is for educational and empowering purposes only and is not intended for personalized medical advice. Consult your personal healthcare provider for personalized medical advice. Welcome to What the Gut, where we create our own path to holistic health, one episode at a time. Today, I'm thrilled to welcome Dr. Clement Lee to the show. Dr. Lee is an expert in regenerative medicine and injection therapies, specializing in chronic illnesses such as Lyme, mold toxicity, parasites, hidden infections, and environmental toxicities. Dr. Lee has been at the forefront of cutting-edge IV therapies, including vitamins, botanicals, peptides, ozone, IV laser, and photodynamic therapy. His approach goes beyond conventional and even functional medicine. It really combines modern advancement with holistic care to help the body heal at its deepest level. Not only does Dr. Lee help patients optimize their health, but he also is on his own journey of biohacking aging, inflammation, and regeneration. Dr. Lee, welcome to the show today. How are you?
Thank you, Alice. I'm well. I'm excited to share with the audience all the stuff that we have to do.
Yeah.
All this out there, actually.
Yeah, I'm really excited to hear about it also. And I know you just incorporate all of these different modalities whenever addressing chronic health concerns. How do you do that exactly?
So that's a really good question. Foundationally, as a naturopathic doctor, we just know to use more natural means and look at the body's own healing abilities. I guess I kind of work in the standard order of operations where you assess the patient, find out what their obstacles to cure are, whether it's infections, pathogens, toxins, lifestyle, diet, mental stress, and then figure out which one of those are probably the higher priority in this area, and then start restoring order and facilitating some of the organs to function more efficiently, nervous system to function more efficiently. And then as the body starts to encourage its strength back, you can then more directly target some of these things. So some of the pathogens, as far as parasites and things, jump in directly with antiparasitics. And sometimes if the liver is dysfunctional or they're not eliminated properly, you got to make sure that those foundational organs are working well. And then you can start layering the different agents, such as killing or then restoring harmony as you go. So it's a balance. It's very individualized person to person.
Yeah, I love how you just said restoring order to the body. And you take approaches that integrates regenerative medicine, IV therapies, and these holistic modalities. But really, whenever you decide which combination is best for somebody, it's really just a personalized approach. Like you said, seeing where their body needs the most support, right? Yeah. So what are some of your favorite treatment modalities though?
Favorite ones at the moment are some of the injection therapies. So I started off with doing regenerative injection therapies, and this is like prolotherapy, now prolozone, PRP, stem cells. So these are for more orthopedic conditions where we're injecting tendons, ligaments, even cartilage to allow regeneration. So this is very good for the stability of the structural part of the body. So sometimes that can make a big difference on how a person feels if their head's on their shoulders properly or their shoulders not aching them when they're sleeping at night. that's the, kind of more of my foundational bread and butter. But on the other end of things, I really enjoy treating the nervous system. So this is where it can get really big changes for a person with very minimal input compared to some of the other therapies we do. So there's a therapy called the neural therapy. So I'm not sure if you're familiar with that at all, but it's just
I
using,
don't think so.
oh,
I don't
it's
think
just
I
using this.
am.
Okay, no worries. Not a lot of people are. It's actually not as big in the US as it is in Europe or South America even. But it's a very simple process of using procaine, which is the primary substance that we're injecting in. So procaine's a local anesthesia, similar to Novocaine when you go to the dentist. So procaine has an ability to reset nerve functions. So when you're numbing the nerve, you're actually resetting its actually polarity and the electrical chemical sensitivity of that nerve. So you can inject them directly into the nerves, for example, the vagus nerve or the suprastellate ganglia, which is one of the big pathetic nerves. So you're basically just restoring order in those nerves. You're just giving the body a chance to reboot those functions. The other thing with neurotherapy is you can actually inject into scars or any interference blocked areas. Sometimes where the tissue is disrupted or there's actual scar, it's actually blocking the flow of electricity through the body or even light or even like blood flow through that area. So when we inject into those areas, it gives the body a chance to restart and repair, remodel those areas. So you're just allowing the body to reconnect with itself with these type of
Wow.
injections. So it's really
That's
neat.
so interesting. Yeah, that's really interesting because it seems like so many people could benefit from that, like in different ways too.
Yeah.
That's awesome.
Because yeah, that's where I'm starting off with a lot of patients nowadays because the nervous system is highly stressed right now with the environment, the world in general. So when we get off kiltered, it's hard for the body to try to heal because it really heals well when it's in the rested state. But if you're always like in a sympathetic dominant or fight or flight mode most of the time, it's hard for the body to just regulate itself in terms of hormones or the immune system or just your gut. So this is why I like to intervene with these type of therapies. There's more than this type of therapy that can address those nerves, but this one does it really quickly.
Yeah. So how quickly does that work for somebody? Or does it really depend on what exactly the issue is?
The effects of the injection are instant. As soon as the needle goes in and the nerve is flooded with anesthesia, the anesthesia works within seconds. The effect that a person can feel is actually feel automatically relaxed for the life of the anesthesia, which is about 20 minutes. It's not very long, but it's enough to get the body that break that it needs. The after effects to vary person. Some people, they can get them really stable and calm and they can be really relaxed for weeks, if not months on end. But some people are really high strung and have a lot of stress. They may need multiple treatments. They may not feel that much with one session. So they may need to do a few more. The analogy I can give is you have a computer that's been on forever and you have like tons of programs going on. So the
Yeah.
injection is like a reset button for the computer. So it gets the chance to start over again, but you still may have tons of apps open. So those apps still might be running and they still may take a lot of bandwidth. So eventually you might need to reboot again. So if you can close some of those apps as it's restarted, then in the future you may need less and less treatments to get your body back to a neutral state or a manageable state.
I like that analogy, and I think other people out there can understand it better that
Yeah,
way too.
yeah,
Yeah, that's so interesting, and you personally have used a lot of these different treatments that you do recommend to your patients, which is awesome. I
yeah,
think every provider should do that for sure.
yes.
But what treatment specifically, like, has been the most transformational for you in optimizing your own health journey?
So one of the also more recent treatments within the past year, so it has been some of the IV therapies, including CBD. So
Yeah.
CBD, yeah, I was not that big into CBD prior to using IVs. I had some oral products on hand, but I wasn't really big on prescribing them all the time. But with the type of CBD IV that we've had, been able to clear a lot of chronic hidden infections from my system that I probably knew of or didn't really get to address directly. So the CBD that we use, the particle size is extremely small. It's down to the pico size. So it's really tiny, which allows it to flow in every nook and cranny of the body very easily. But as that effective of what CBD does, it also has a natural antibacterial effect, antifungal effect, even anti-parasitic, and potentially antiviral effect. So you're just bringing down the load of any of the infections. So that the particle of the CBD can actually get into the bacterial or fungal cell wall. It's just that tiny. It starts to neutralize that cell. So all the contents of the cell dump out. And so what happens is typically after an IV with this particular version of CBD, you get a flu-like response. So you get body aches, chills, fever that occurs about 2 to 4 hours after the IV, which actually wraps up your immune system to respond and clean up house. So you may
Yeah.
feel uncomfortable for about half a day to a day, but after that fever lets up, you knock down a load of infections. And so this
Yeah.
works for the thing is like during I think the last year I had some long COVID like respiratory stuff, so I was just coughing mucus. Even though I did all the other stuff to help, there's just some residual like mucus that was left behind. So that took care of that. And then I have history of like mold exposure, so I've had numerous amount of fungal symptoms in my since my teens. I had feet that had a little bit of fungus and blisters. And then after doing several IVs, some of those fungal symptoms completely went away. So then it's so where you can get at these things without having to take a whole bunch of different herbs and medications. If you do a series
Yeah.
of some of these treatments, you just knock down the load of other things as you go. And then the more I get into like research about the CBD, you also refueling the endocannabinoid system. So you have better immune regulation, you have better stress regulation, you have better inflammatory control. And then some of the other benefits for longevity wise, you have better NAD production or better stem cell activity. So it's really neat what you can do with this
Yeah.
CBD.
And I'm sure if you were to go have a session and have the IV therapy with the CBD, the next time you do it, it's not like the after effects of the flu-like symptoms aren't
Yeah.
gonna be as bad because
Yeah,
your
that's
body's
exactly. Yeah.
fighting it off. That's
Yeah.
so interesting. Now, I have not I've been familiar with the CBD oil and the different kind of CBD treatments, but I have not heard of it in IV form. So that's really interesting to me.
Yeah. It's very unique. I think the company's only been around for like 2 years. So got it
Okay.
early on. Yeah.
Okay, and I'm in Mississippi, so, of course, we'll probably hear about it in 10 years, but
Who knows,
it's
you know?
Mississippi's a little behind on some of that stuff,
Okay.
so a lot of times, like, these newer things, I hear about them happening in all these other
Mhm.
states, which is awesome. If somebody were to want this kinda treatment you see a lot of these little pop-up clinics places where people can just
Yeah.
walk in and get whatever kind of infusion they want. Is this
Mhm.
something that people can easily get somewhere if they're local to you, or do you really need to see the provider, make sure it's right for you? Like, how does that work?
Yeah. For our clinic, we do require like consultations prior to the visit. So that way we can get a established history on the patient and then also recommend the appropriate treatments. There are some
Yeah.
of the IVs that people could get just walking in, but we don't offer that particular service. I know there's clinics across the street from us that are just IV bars. You can just walk in and pick what you want. We provide our IVs more in a clinical setting. So that's why we can customize things as we go, but it's really at the doctor's discretion and working with the patient there. Because, for example, like the CBD, if you just walked in there and you did it and you feel like crap the next day, you're going to be very worried or you don't know what to expect. You start having the fevers and things. That's
Right.
example. Yeah, we don't want to have anybody run into those issues.
Yeah. No, I love how you pointed that out though too, because I travel a good bit and I see different IV pop-up clinics and some of it sounds really interesting, like a good immune boost to getting all
Mhm.
these vitamins and things. But even myself, I'm like, I don't know if I want to just walk in somewhere. Like I want to see a provider first, even though I am a provider too. I'm like, I want somebody to
Yeah.
really tell me if this is the right thing for me because no matter what it is, you might have these side effects
Mhm.
because your body's responding appropriately, but if you don't know that, you might go into that and have those side effects and think, "Okay, I'm never doing that again."
Yeah.
But really, like, it's benefiting you, but
Mhm.
yeah.
Again, there's
So
the order that the body has to run through, and you just started something.
yeah, and especially if you're talking about, like, restoring the order, like, you didn't
Yeah.
get to where you are by just feeling great all the time, so you've
Yeah.
got to fight off everything. Yeah.
Right.
Now, I know that there is like this growing interest in longevity and biological age reversal. I know that's so prominent now. A lot of books and podcasts are coming out about it. What do you think are some of the biggest like underlying threats to aging and inflammation that people overlook?
So that would be just one stress. So you have your continual stress from whatever things. This could be your personal life, your past childhood, different things of how you interpret or perceive these things over time. So they're running background operations in your head. driving physiological response, basically creating stress hormones or kind of depleting your immune response. So that's something that it requires work. You can't hear that overnight, but a mindset shift or neural therapy is a quick way of getting your body downregulate a little bit faster. But really, the long term thing is just changing your perception and mindfulness. Just getting to know that you maybe can't control the world, but you can control how you perceive the world. That's a big hidden one. Sometimes obvious for some people, but sometimes we forget that's like the main thing that happened. But the other
Yeah.
things are then you think about like infection. So we are exposed to tons of different bacterial, viral, parasitic, fungal organisms day in, day out. Our own immune system's supposed to help us defend a good majority of those things, but sometimes they make it in and they set up shop inside our system, and it's a low graded immune response that their body's trying to deal with all the time. The parasites are notorious for that. So I'm sure you're familiar with some of these. So
Yeah.
parasite, you can't avoid that at all from our diet. You get some water that might be contaminated, you get some vegetables, meat, whatever. They're gonna find their way in and set up a new home. And they do have ways of evading the immune system, and they also secrete different toxins and control different aspects of your nervous system and your brain functions too. So they can actually drive you to have poor cravings or mood disorders or just inflammation in general. So
Yeah.
if you don't treat them, they're just going to hang out for probably forever. So then this is where if you understand that concept, you can periodically, episodically treat for them. You can test for them, but the testing in the US really does not get to them very well. So you always can get false negatives on these. So that's where you can address parasites. Other hidden infections, this is why I like the CBD because it tackles a lot of things, but we have different nutrients and supplements and things that can address different types of infections, whether it be bacterial or fungal or viral thing and parasitic. So there's testing to identify some of these things. So the problem is there's so many different pathogens out there. It's hard to identify which ones just from a simple test, but there are some that can guide you in the direction. Some of our foundational lab tests, if you know how to read them, functional labs, you can tell that when there might be some immune system in overdrive or underactive because of a long-term fight. So those are where like those hidden threats are these infections, because again, they're stealing your immune response and they're releasing waste chemicals that your body's expending energy to try to deal with, which is then actually making your stem cells have to work a little harder so that you can
Yeah.
build your energy reserves or stem cell reserves that way. Some of them also cause mitochondrial damage too, which is the energy functions for your cells.
Yeah. Yeah. I love how you just
Yeah.
explained all of that. Yeah.
Yeah.
So I want to go back and talking about like the CBD though. I have a question. So you can get CBD in all these different forms. The molecule being so small whenever you're doing the IV treatments, how that can cross so many different barriers and get into all these different cells. Is it that small with all forms? Like what is the benefit over IV therapy for the CBD
So
specifically
yeah,
versus different types of therapy with CBD?
great question. So the a natural form of CBDs when it's extracted are usually in a fat soluble base. That's why they're mostly like oil based tinctures. So it's CBD by nature is more lipophilic. So it likes the fat substances. So
Yeah.
when you get it in the system, it can go through the body, but since it's usually adhered more to like fat cells, it's maybe harder to get it through all the systems in the body. This particular form of CBD is actually water soluble. So
Okay.
it's basically it's in a water base, which allows it to actually get through the body a lot easier. So
Yeah.
that's the difference. So there's a lot. It's hard to actually do that in a lab where to make CBD in a water soluble base. If you did, it would be probably a little bit more absorbable. But again, it's not as common like just when you're extracting the CBD. Um,
Right.
so then, so there's that. But then the company does make CBD products in different particle sizes. So this is where there's actually some hydration clinics that can offer CBD that's not going to make you feel like crap afterwards. So the
Yeah.
particle size is not, it's large enough where it's not actually getting into the cell. So you get more just what the normal effects of what we know about CBD is like the relaxing,
Mhm.
anti-anxiety, sleep benefits. So those are some options available in the realm of CBD.
Gotcha. So if the molecule's bigger, like it is in just the more natural form because it's fat soluble, it's not going to penetrate those molecules as other molecules in the body as much. So you're not going to have those big side effects like you would with the IV
Yeah.
therapy.
but so that's a benefit, but
Yeah.
it's also not getting into the cells as much as it could.
Yeah. So you're
So
not chilling as much. So you get the
right,
immune
okay.
modulating effect. So you do get relaxation, but you're not actually eradicating, say, pathogens as nearly as well as the smaller
Yeah,
molecules.
that makes sense. That's so interesting. So I wanted to ask about, like, some of these other treatment modalities you do. I am just now hearing about a lot of them, familiar with them, but honestly don't know a lot about them. So as far as peptides go, like, what's the deal with peptides? I've heard so many great things about them.
Yeah.
I'm like, I really want to take a course on them to learn more about them
Yeah.
because a lot of people are asking about them too. But I
Yeah.
know that there's so many benefits to them.
Yeah. So peptides are probably one of the best direct communications for our cells. So the body communicates via peptides for one of the ways. And peptides are just naturally occurring amino acids in a certain sequence. So it's like a cheat code, for example, just to tell the body what to do. Or they're just words in a letter or in a paragraph that you need, but those specific words tell the specific instruction for the body of what to do next. So one of the most known peptides is insulin. So insulin is actually a peptide. It regulates so many functions that's essential to our life. But other peptides are a little less known, but they do work on different pathways of the body. So there's peptides that help with tissue regeneration and actually repairing of the connective tissues. There's peptides that actually help stimulate growth hormone release. There's peptides that actually work on the pineal gland. So there's different peptides that give different instructions to maybe different organs or sometimes multiple organs at the same time. So they're just a faster way of affecting the body because like with vitamins and minerals and herbs, they do work in different areas. So for example, like vitamins are just the raw building blocks that our body needs. Without the
Right.
appropriate instructions, they may not do very much. So the cells may not
Yeah.
know what to do with it next. Whereas herbs are more also communication as well too, but just via more chemical mediated pathways. So they do have some effect on the system, but the peptides are just directly cellular mediated. So they're telling the specific instructions. So the DNA inside what to do next.
Yeah. And it just, if you think about it, like vitamins and minerals, replacing those and taking them are great. But if you do have some kind of disorder in your body where you're not like absorbing those properly, or like the communication is off, your cellular communication is off for some reason, they're not going to be doing as much as they could. But using certain peptides, I know I've heard of people using them to heal faster after
Yeah.
injuries, or I think everybody's talking about the GLP-1 peptides right now, which
Yeah.
your body naturally has anyway,
Right.
but just speeding up that communication pathway. It's just an interesting concept.
Yeah. Yeah. That's why it's when you're trying to move the needle faster, peptides definitely help you move the needle faster. So because
Yeah.
before the use of peptides, I think peptides came to the market probably 10 years ago or so. So during that time, it was still on the fringes. Not a lot of people knew about it. But if you were just using like botanical medicine or vitamins, minerals, you see the rate of cure for people. Sometimes it takes months to move the needle in certain cases. For peptides, probably within a couple of weeks, you start noticing some drastic changes. So this is
Yeah.
where it's nice that now they're more readily available. It's still not 100% like easily accessed, but they are more readily available. And yeah, I encourage anybody who has access to them to try them out because there really is no downside with these peptides. At the most, maybe just you getting a little irritation at the injection site from the actual poking yourself, but most of them actually just communicate to your cell what to do next.
Yeah. I was gonna ask, there's a bunch of different kinds of peptides, but as far as, like, side effects or downsides or things to watch out for with them, it sounds like you're saying there's not a lot of side effects or big things to watch
For
out
the
for.
I see for the average person, no. The
Okay.
patient population that I see, which are some of the sicker ones, there could be sometimes paradoxical reactions because you're turning on the engine that's needing to
Yeah.
be ran, but there's a lot of other things inhibiting or still needing to get processed. Because, for example, they have a lot of mold toxins or a lot of chemical toxins that
Okay.
they didn't have the energy to process those before. And now all of a sudden they have all these things that are coming to the woodwork. Yeah, those are where you have to watch out for. But for the average person who is reasonably well that has an injury, these are great ones to add in. Or you have minor gut issues, and that's actually great to add in as well.
Yeah, and that makes sense. It's what we were saying before. You're gonna have more of these side effects if your body's trying to overcome more because it's trying to
Mm.
jump through those hoops. So that makes sense, yeah.
Yeah,
Now, like ozone therapy, tell
yeah.
me about ozone therapy.
So ozone is naturally occurring in our atmosphere, usually after a lightning storm, but it's in the use of clinically in medicine, it's a kind of stimulator in certain ways. We have ozone in the use for via oral. There's actually ozonated oil capsules you can take. There's injections locally directly into the joints. There's IV ozone. There's nasal. There's rectal. Ozone can be pretty much put in any part of the body except for the lungs. The body has the ability to metabolize ozone in most of the parts of the body except for lungs. You don't want to be breathing ozone indirectly. So that's the
Okay.
only where, that's the only area you're having some issues. But when you introduce ozone into the system, it actually creates a little bit of irritation briefly because ozone is reactive oxygen. So it has three molecules of oxygen. So that third oxygen molecule, when it comes in contact with your own organs and tissues, that third molecule will be shut off. That creates a little bit of oxidative stress briefly, but it binds then to like the water that we have in our body to create hydrogen peroxide, which is H2O2. So you actually have a second molecule of oxygen to the H2O. So then that is what the body
Taking me
actually
back to chemistry
Yeah.
now.
Yeah. But the body naturally creates hydrogen peroxides as a way to defend itself against infection. So
Yeah.
if you have a virus or infection or even cancer, the body creates a little peroxides to stress those unwanted cells. It's a way of sparking the immune system on its own to wake up a little bit. And the other added benefit is just the pure oxygenation of the tissues. You leave behind just other O2 that floods the body. So you just get a little proliferation of extra oxygen for the meantime. So when you do it as an IV, it has multiple cell mediating effects. So it's good for activating stem cells, activating white blood cell activity. You have a direct impact on any of the viruses, bacteria immediately in the system. But it's those after effects that kind of linger for a while. And then for joint ones, this is what I use primarily for our regenerative injections. So we use ozone as an irritant into the joint. For example, injecting to the shoulder, the ozone is going to irritate the connective tissue that's there, and it stimulates a new injury inside, which then allows the body to send new blood flow, nutrients, and even stem cells back into that area. So people have like old sprains, strains, tears. They heal to an extent, but they stop healing because there's not regular blood supply continuing to be in that joint. So the ozone is just a kind of catalyst to wake up the area, start over again. And then you get the extra benefit of more oxygen in that area, and then the stimulation of stem cells and other things that come with that area too. So it's a great way of
Yeah.
just waking up the area to know that there's attention that's needed.
That's so cool. That's so cool. Yeah.
Yeah, and
No,
when you put it up your nose, it's good for like a sinus infection because ozone is immediately coming in contact with all these unwanted microbes and even viruses in the sinuses, and so that does create a more immediate effect of just clearing out all the waste in the sinuses. So you just don't want
yeah.
to breathe it through your lungs, but just hold it in there and blow it all out.
Yeah. That's so neat.
Yeah.
Now, like IV laser and photodynamic therapy, I don't even know if I know what that is. Like, what
Okay.
are those two different things?
Yeah, they're
Okay.
two
So,
different things. Okay. You know about putting red light on the body. So that's
okay.
photobiomodulation. So using light to influence
Okay.
the body. So the IV laser takes it to a different level because for topical light, only certain frequencies can penetrate through the skin. So red and infrared are the main ones that can actually make it through the skin. But we have other colors of the rainbow. We have UV, blue, green, yellow. They don't make it through the skin very well because our skin barrier just blocks that absorption. So
Yeah.
in order to get light into the cells of the body, we could bypass the skin and get it directly into your bloodstream via the IV laser. So how we do that is we just get a normal catheter, like when you get an IV, and we thread a fiber optic cable that actually fits inside that catheter, and then you attach it to the laser device, and you get light directly shining in your blood. So all the blood cells that pass through it are being activated by different colors of light that we choose. So that's a way of getting light to influence your cellular functions.
Interesting.
What's neat about this is your cells actually have photoreceptors. So they have receptors for light. Mitochondria actually has multiple photoreceptors that help with the function of generating more ATP. So when we're doing this, you actually can get more cellular energy, more efficiency in energy by getting just light in the system. So that's one part. Then the additional part is what we call photodynamic therapy, which is you're adding a photosensitizing agent. So this can be a vitamin, it could be an herb, it could be a medicine, but so a lot of these things have light capacity. So different vitamins actually absorb light at different spectrums of color, depending on what type of vitamin it is. For example, you may have heard about methylene blue. So methylene blue has an ability to absorb red light at higher potential than all the other light colors. So if you take methylene blue, either orally or an IV, and you shine red light into the system, it's actually allowing those cells to absorb more red light than it normally would. So how you can use it in multiple ways is one is just enhancing mitochondrial function, because the methylene blue is utilizing the mitochondria as well, and red light also helps the mitochondria. So you actually enhance better utilization of the oxygen and the mitochondrial function. So you're just getting 1+1 is equals 2 or 3 or 4 or 5. So more, just much more than them individually would be. But on another note, this is where it's very, really exciting, is it also has powerful anti-pathogen effects too. So this is through the photodynamic therapy. So it relies on the presence of oxygen. So oxygen has the oxidative capacity. So when you shine light with a substance, it actually causes a lot more oxidation to whatever absorbs it. For example, I'll use methylene blue for another example. Methylene blue is also uptaken by bacterial and viral organisms as well. So they actually get stained with methylene blue. On its own, it has some mild antimicrobial effects, but when you shine red light in there, it's forced to absorb more energy and more oxygen than it can possibly handle, because it doesn't have like its own antioxidant capacity. The viruses don't have much to defend themselves. When you're forced to actually influence more light in there, the viral particles or bacterial particles, they get oxidized, and basically their DNA gets destroyed upon contact with that extra energy. So then that's another way of lowering the microbial load in the system. At the same time, is it doesn't really harm our body, because our body has natural antioxidant capacities to deal with that extra oxygen and use it up.
Yeah.
So that's where photodynamic therapy is really neat, because you can use it with, for example, riboflavin is a very common one that's used. Riboflavin is just vitamin B2. If you think about it, it helps with a lot of basic functions. But riboflavin is used in our DNA as well as the DNA of bacterial, fungal, parasitic, viral organisms. But riboflavin is very light sensitive for UV and blue frequencies. So when you shine that light into the system, it absorbs way more light than that organism can tolerate, which creates their DNA structure and neutralizes that pathogen. UV on its own already does that, but if you added the riboflavin in there, it just absorbs even more UV light. So it's another way of just killing off things that don't belong. And it doesn't really harm our cells too, because our body can use UV light very well as well too. So it's really neat how we can use it as a selective thing. Even for cancer, this is where we're utilizing it so much for cancer, where you can take photosensitizing agent that only cancer cells absorb, and then you shine the light in there that forces the cancer cells to absorb much more oxygen than they can handle, thus selectively overstimulating those cells to the point where they're just dying off.
Yeah. And like riboflavin is essential to make energy for our cells. And
Yeah.
it sounds, it's so cool. It's so cool.
Yeah.
It sounds like all these different therapies, there's like an overlap of how they work, but they're all different. So I can see why some of
Yeah.
them are more unique to certain people. It's so interesting. Now, I'm curious. I know that you emphasize really how the body is got the ability to heal itself, and all of these different treatment modalities are things that like our body already naturally does. We're just like promoting things and pushing it. So,
Yeah.
can you share any kind of story of a patient or even with yourself that really like highlights any of these therapies, like just transforming them?
There's a reasonably recent patient that had a chronic Lyme, also mold, just basically very fatigued, brain fog, body aches, that actually had gone to a very prominent Lyme doctor and did the hardcore antibiotic courses, and just maybe got like 20-30% better, but still not like nearly when it really needed to be. They actually still had to be on antibiotics in order to feel okay. Without the antibiotics, it would fall back. So we got in her to do like a series of these IV treatments that actually stacked multiple ones together, which involved using colloidal silver IV, methylene blue, ozone, CBD, and laser. So it was a pretty potent antimicrobial treatment. And then we offset it on a different day using more like antioxidants. So like a multivitamin IV with glutathione, like poly-MDAs and other like antioxidant compounds, and then phosphatidylcholine and gluten. So that combination is more like cell repair. So we alternated those on different days and got her through a course of about 8 treatments of each of those. And then we did get to see her through the rest of the summer. And then I found out like after the IV treatments, like she was probably 80% better without antibiotics at that point. So she got significantly better just by reducing the pathogen load and starting to cell repair. we didn't really touch the mold issue at that time. We didn't even address that. So it was primarily just knocking down some of the Lyme. The good news is like with all the other treatments, you're also indirectly or directly addressing mold as well too, by
Yeah.
reducing some of the fungal load and supporting some of the cell functions. But if I look after that, it just started getting better and better. But yeah, it was just a nice, just using some of these more advanced laser and IV therapies, we're able to move the needle in really to one of the tougher conditions, because as like Lyme is a difficult one to treat, and sometimes antibiotics can work, sometimes they really don't. And there's a lot of layers to this, but just having that combination really moved the needle pretty drastically on one of the patients that we saw last year.
Yeah, that's awesome. Some people go years without even being properly diagnosed with Lyme too. And so many of the symptoms are so unspecific to anything, like they could be anything. And I know that's such a hard one to get rid of, but that sounds like such an intense treatment. That's
Yeah.
awesome. That's crazy. I'm curious if anybody wants to look more into these treatments, where can they learn more about you, what you do, or find somebody local to them that does
Uh,
any of these?
okay, so my website is www.opthealthwellness.com. So short for optimal health and wellness. It has a list of a lot of the therapies, as much detail on there. And there's some that I'm still working on trying to put video content to explain around some of these things. I'm working on our YouTube videos as well too, but so that's not immediately. You can take those terms and search online for different providers nearby who offer like something like called photodynamic therapy, or even the CBD IVs to start, or neural therapy. So those you can start with. That there may be providers somewhere nearby you that do this. I do have patients that do fly in from different places because it's not often that all of these therapies are available in one place. But there are people out there that do neural therapy. It's probably more common than if you are start looking for it. It might be more common than otherwise. But as far as
Yeah.
CBD, there are more and more clinics, functional medicine clinics that are popping up utilizing CBD. They may not use it as long as I have, but they can start experimenting. And if you have access to it, the first thing is just need access to it. So you can start using it. Every patient is experiencing it on their own, which gets the collective experience of the CBD. But as we know, it's very effective. It's just individualized at how each person's going to respond. But there are clinics that are popping up throughout the US that can access the CBD. So it's not, let's say, necessarily hard for a provider if they wanted to implement some practice to get it. So they could do it. It's just, so if you know a functional provider that wants to do IVs and add in CBD, that'd be a good place for you to try it to get started.
Yeah, that's awesome.
And this with a laser, yeah, you have to look up people who do the intravenous lasers. There's different types besides our device. There's one that's more topical laser that you can put on top of the catheter site. So that's another option for people to get some type of light. There's variations where you can get a laser watch that also helps too. So these are just other ways of people having access to laser.
Yeah, that's awesome. That's awesome.
Yeah,
This has been so cool. Thank you so much for being here today, Dr. Lee.
of course. Thanks for having me, Allison.
Thank you for being a part of my journey on What the Gut podcast. For a deeper dive into today's topics, head over to allisonandwellness.com/whatthegut or find the detailed show notes linked below. Hey, and don't miss out on future episodes. Hit that subscribe button, and if you love this one, please leave me a review. Let's keep the conversation going over on Instagram. Connect with me and stay updated and engaged with my awesome community. Plus, share these valuable insights with your tribe. They deserve to feel as amazing as you do. You can find me at Allison_and_wellness on Instagram. Your support means the world to me. I'm looking forward to our next awesome chat. But until then, stay curious, don't drink too much coffee, keep the vibrant energy flowing, and take care of your gut. Catch you real soon. Oh, and hey, if you're ready to dive deeper into personalized wellness, check out my one-on-one health coaching program at allisonandwellness.com. Let's make your journey to holistic health truly transformative.
Hey there, it's Allison. And if you're anything like me, coffee is a non-negotiable part of your day. But did you know that most coffee is loaded with mold, toxins, and pesticides that could be messing up your gut and hormones? Yeah, no thanks. That's why I only drink Purity coffee. It's organic, tested for toxins, and it's packed with antioxidants that actually support your health instead of wrecking it. It's smooth, delicious, and best of all, it does not leave me feeling jittery or bloated. So if you're ready to upgrade your coffee game and support your gut at the same time, grab a bag of Purity coffee today. Your body will thank you. Oh, and because you are part of the What the Gut family, I've got a special link just for you. Just head to puritycoffee.com and use code AllisonGetsWell for 20% off your first order. Cheers to coffee that loves you back. Hey friend, let's talk about something real: bloating, stomach pain, and fatigue. You do not have to live like this. I know because I was there too. I was frustrated, exhausted, and trying everything, but still felt miserable. And that's exactly why I created my Get Well one-on-one gut health coaching program to help women like you finally get to the root cause of your symptoms, heal your gut, and feel like yourself again. No more guessing, no more Band-Aid fixes, just real, sustainable solutions tailored to your body. So if you're ready to ditch the bloating, boost your energy, and actually enjoy food without discomfort, let's do this together. Head to AllisonGetsWell.com or reach out to me on Instagram at AllisonGetsWell to learn more and apply today. Because you deserve to feel good in your body every single day.